All right, good afternoon. Can everyone hear me? Nice and clear? Okay, wonderful, wonderful. So I just want to put my presentation into context. So actually, I work for Lancaster Square Care Community, but I also did my co-op placement there. Further to that, I'm the executive director there. So it makes things a little bit more complex. And to further put some more context, just less than 48 hours ago, the Ontario provincial budget was released, and they announced three things when it pertains to long-term care, is that they're going to be putting $10 million into our Behavioral Supports Ontario program, and another $100 million over the next 3 years via our Ontario Dementia Strategy, and increase 6.5% of funding for raw food costs, which is to the food that's cooked, the meals served in long-term care. So embracing change, the culture change journey. We go right into looking at Lancaster Square, which is this beautiful edifice right here. It's a 160-bed care community, which we provide 24/7 resident-centered care. The departments you see there is, our clinical, dietary, physiotherapy, recreation, environmental, and the list just goes on and on because of all these stakeholders that we partner with. So being a team member, so I was pretty much undercover boss for those 2 days a week that I had to be there. I analyzed culture change initiatives, engaged with residents and team members, participated in meetings, and did a number of presentations to a regional team of executive directors, the VP of operations, HR, and members at support service office, which is our head office. So my practicum case was instituting culture change designed to improve interprofessional education and team communication at Lancaster Square. So let's look at readiness for change. So the readiness for change, I looked at 4 ways to measure, and that was change awareness, change agility, change reaction, and change mechanisms. So for change awareness, to start off this is where I had to begin to identify change strategies to redefine where it was necessary. As I looked at trends to give opportunities to change practice or to make enhancements for our residents. There we go. Next was change agility. My engagement was important with the team members as we looked at new knowledge and new practices which were identified in order to build capacity. And I also had to take a step back to observe the team members in action on their home areas. So when I mean home areas, they're also units. And also through their communication and civility. Especially in long-term care and dealing with interprofessional group is that you have a lot of miscommunication and it gets really complex to connect everyone together. Change reaction. Flip over here. So I had to be aware of my own reaction to change and assisting in helping others react to change and plan for the change accordingly. It was important to be able to analyze problems, assess risk, and manage the reactions of team members. And for change mechanisms, it was important to be visible on the home areas, which were each unit within the care community, and to determine where team members were at in terms of implementing recommended changes in practices. And I also seek to build partnerships with key stakeholders at this time. So the PHSP values that I utilized were diversity, partnerships, and interprofessional and multidisciplinary approaches. Diversity, I looked at shifting our views so aging will bring awareness to having caring culture and improving civility. Partnerships were to come together and collaborate on enhancing living environments, which is the life on the home areas, and supporting the well-being of all of our residents and family members. And finally, interprofessional multidisciplinary approaches were to look at how we made our decision and how communication occurs and how we resolve conflict. And for the recommendations, I'll just skip right on. Well, the main thing was the leadership skills and influence. And a big thank you to Lancaster Care Community, my family, my supervisor, Jill Gibson, Gil Stewart, VP of Operations, and the senior leadership team at Sienna Support Office.
There we go.
Thank you very much.
Thank you.
Any questions?
There. Questions, there we go.
Hi, my name is Sabrina. Thank you for your presentation.
Thank you.
I know in a couple of our courses and through our discussions, we really discussed the kind of intergenerational approach to senior and residential care. So just wanted to know what your thoughts, because you have working experience in that field. What are your thoughts on that?
I 150% support it. So at Lancaster Care Community, we do have intergenerational programming. So to just give you an example is that we are partnered with 3 different public schools where they would bring in, we would get the senior kindergarten groups to come in, and then we would have such things as give you our holiday dinners, and we will include them, or holiday crafts, for example. Another big thing that we do from an intergenerational perspective, and we actually won an award for, it's called Cyber Seniors. And so we partner with high schools, and the high school students will come into the home, and they would teach our residents how to use the internet or do word processing, etc.
Thank you.
You're welcome.
Question? Okay.
You mentioned that interprofessional miscommunication was part of an issue,
Yes.
and I was just wondering what factors you think lead to that and how they might be mitigated.
We got 3 hours to talk about this. The major thing I would say when it comes to the miscommunication is the understanding of roles in long-term care. So now in Ontario, we have to meet over 300 regulations when it comes to the Ministry of Health, who inspects us. So therefore, everyone is just sometimes so focused on, I gotta do my role, I gotta meet all these expectations, but then we forget to talk the interfunctional communication and the cross-functional needs of the long-term care. We almost become siloed. And it's up to the leadership really to help break down those silos so that we have that collaboration to ensure the success in long-term care, because there will be no success in long-term care if you can't collaborate and work together as a team.
Thank you so much, Dwayne.
Yep. Thank you.